and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we are going to be talking about RSV during the flu season. Here with me is my guest, Dr. Tarebiye Pela. She is a pediatrician with West Tennessee Medical Group, and she works out of the Thompson Farms and the Lift Clinics. Welcome to the show, Dr. Pela. Thank you for joining us.
Good afternoon. I'm happy to be here.
So this is your first time on our podcast?
Yes, it is.
Great. So how have you been? It's the holiday seasons. How's work been going?
Busy.
Very busy, yes.
Very busy with lots of sick kids.
That's right. That's this time of year.
Yes.
So this episode, we're talking about RSV in babies and children during the flu season. So flu season, a lot of people are getting sick. A lot of people are carrying germs around.
Yeah.
So we kind of want to talk about ways to help during this time of year to kind of make sure people know what to expect and know how to prevent it. So kind of give us just a general idea of what is RSV.
RSV is respiratory syncytial virus. It is a contagious respiratory illness caused by the RSV virus.
Okay. And so how would you contract it?
You would contract it through someone else that has been sick and they're coughing, they're sneezing, they're letting out respiratory droplets.
Right. So it's in the air. But
in the air.
Does it land on surfaces? Like if you touch something?
Yes, it does land on surfaces, and you can touch those surfaces and touch your face, touch your nose.
Right.
Put it in your mouth, and like kids always do in daycares and playgrounds.
Right, the floors, just
everything goes in their mouth. Yes.
Any and everything.
Yes.
So we want to make sure parents and caregivers know clean things often.
Yes, they're
and
always cleaning things.
Make sure you wash your hands.
Wash your hands often, clean things, avoid sharing cups and utensils for feeding.
Right. So if a child or a baby gets RSV, how does that affect them? What are the ranges that they can have? Do they get mild? Is it mild to serious?
Okay, so the RSV virus, once you get infected by it, can cause from very mild symptoms to very severe symptoms and even death. And the mild symptoms could be just a runny nose, and there's nothing, but you can get a fever, you can get coughing, stuffy nose, runny nose, headache, tiredness, decreased appetite, cough with difficulty breathing, where they're using their stomach muscles to breathe. And this is usually the reason we admit those babies.
Right. Because if they're sleeping and you hear them stop breathing, that's obviously...
Yeah, that's obviously a problem, but it's more important because when they are that little and they're having difficulty breathing, they cannot eat. If they don't eat, they get dehydrated. They have decreased wet diapers. So, and then their oxygen goes down. They would need supplemental oxygen. So that's usually what we look for in RSV. Right.
So if you've got a baby and they've stopped eating, definitely something to check out, and you need to go see someone.
Yes.
So what would be the ways you would want to prevent it?
In babies that are 2 years and younger, they are the ones that are high risk. In addition to that, babies that were born prematurely with heart disease, babies that have heart disease that require surgery, or babies that are using oxygen after they've been discharged from the hospital, they're at high risk. So once they contract the infection, their lungs are very immature and their body is not ready to fight those viruses. Yeah. So we want to prevent those babies from getting the RSV, and the most common way to prevent it is obviously the RSV prophylaxis, which in most cases, when we give to babies that are premature, we all know it as the Synergist. But now there is the new RSV vaccine, which is more like a medication, not just a vaccine for kids that are 8 months and younger, and they happen to be within that age range during the winter season, or what we call the flu season. They will qualify for the vaccine.
Okay, yeah. And do they have to get it more than once, or would just one time kind of help?
The new vaccine, it's just once.
Okay.
Now, if the child was born extremely premature and the insurance approves the Synergist vaccine, they get it monthly. Starting from the month of November, we started giving that out up until the month of April.
Okay, great. Do you have any advice for parents who are maybe skeptical about getting the vaccine?
Talk to us.
Yes, come see someone.
Yes. It's actually not the vaccine. The vaccine is not like a live or attenuated virus.
Right.
It's not that. It's a collection of antibodies, and it's an antibody serum that we inject into the babies to help them fight the RSV infection once they get infected.
Right. And so for mothers, would it help if they got some sort of vaccine when they were pregnant to maybe prevent it earlier?
Yes. The new vaccine that's been rolled out is available to the pregnant moms, and it's best they get it between the 36 and 38 weeks of gestation. And if they get the vaccine, their babies don't have to get the vaccine.
Okay.
That's the good thing about that.
Right.
Yes.
Great. So now if your child or baby did contract RSV, what would be the treatment for them once they have it? Is there any?
There is no medication for RSV by itself. It's just supportive care, as in all viral illnesses during the season. And supportive care would mean giving little sips of fluid, make sure your baby is peeing, nasal saline drops into the nostrils. That helps to break the mucus. Loosens the mucus. And using a bulb suction to suck it out. This is more important before you feed your baby and before you put your baby to sleep, because that's when it's really hard for a child to breathe when they're trying to eat and then when they're also laying flat on their back.
Right. So if someone thinks their baby might have RSV, or you maybe just want to get a checkup, where can they find you?
They can find me at the Lift Healthcare Clinic at 101 Jackson Plaza, and I'm there from Monday through Wednesday, and at the Thompson Farms West Tennessee Medical Group Clinic Thursdays and Fridays.
Great. And the Lift Clinic phone number is 731-425-6900. And the Thompson Farm Primary Care Clinic phone number is 731-664-0103. And our Thompson Farms Clinic is actually open 7 days a week. It is 7 a.m. to 7 p.m. Monday through Saturday, and open from noon to 6 on Sundays. Well, thank you so much, Dr. Pela, for coming on and giving us some information about RSV and the flu, and especially if anyone's nervous or worried about it, they can definitely, in the Jackson, West Tennessee area, they can come see you.
Yes, thank you.
And in the show notes for today's episode, I will be sharing a lot of RSV resources and things that we've talked about here in this podcast, so everyone has that information readily available. All right, well, thank you so much for joining us and coming on.
Yes, thank you very much for having me.
Great. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.